It has been a strange last 6 weeks here at RVH. We've had a lot of changes come forward in the last 6 weeks in reflection of the COVID that's been happening here. And we've had a lot of different patients come through. Our unit is only accepting patients that are either COVID positive or COVID pending. So we get anybody that is coming into the hospital with that pending. So we're getting patients that would normally go to surgery, or patients that would normally go to the cardiac center, or patients that may be on the cancer palliative center. So we're getting a lot of different type patients that come through us first before they move on to other places if their COVID swabs come back pending. If they obviously come back positive, then they would stay here for the duration of their stay. Our unit is all isolated patients, so that is a big change. We've always carried on the respiratory unit a high number of isolated patients, but now they're all isolated. You don't need a side board or anything? We wear a gown with every single patient. Our normal procedure for a droplet contact patient is just gown, gloves, and a basic mask. Now we are also topping on top of that a full face shield. Depending on the patient, we also have now respirators that we're using depending on the type of isolation required for the patient. So that's all different for us. It's pretty hot. Yeah, they can be pretty hot, especially when you're not getting much of a break in between and you're just wearing it more or less for the majority of the day. So you can get pretty hot in them, and they can be pretty uncomfortable. At first, I think I have 2 kids at home and a husband. So at first, when it first started coming out, and then obviously we saw everything ourselves on the news more in the other countries before we were initially hit with it. So we had a lot of conversation about what that would mean to us, and how you'd protect your obviously family and children at home. So I know for me, we're offered here the RVH scrubs, so we're no longer wearing our own scrubs. So I come to work in the morning, I get all the gear that RVH has set up and offered for us, and change my clothes into the RVH scrubs. At the end of the day, I don't take anything that I wore from work or had at work home with me. A lot of the people are showering here before they go home. When I come home, I put all my stuff, even the stuff that I've just changed into, in a bag right into the wash, and just shower directly at home. So it's hard, like usually when I come home, my kids always run up and want to give me a hug when I get home. So now it's like no hugs or anything from me until after the shower and after everything's kind of put away. I don't bring anything into the house anymore. I can say is one of the things that has, when this first happened, a lot of the team, everybody was kind of scared and didn't really know what they were going to be walking into at work. But it's been actually over the course of the last 6 weeks, we have been able to continue on and pull together as the great team that we are here on this unit and in the hospital. The hospital's been very supportive and very transparent with letting us know about the PPE and what they're doing about it to make us feel more comfortable. And we've continued to work as a team together to support each other through this. I think with the mandatory stay-at-home isolation and that they've kind of enforced, it has kept it from the numbers rising to the extremes that it has elsewhere. I think people are coming into the hospital when they need the medical attention, but kind of seeking other sources of attention elsewhere in the community that is available to them for that. So I think just kind of people have been staying indoors and listening, and it has helped reduce the numbers from climbing too high as it has in other countries. I as much as everybody else miss everything that I feel like I've had to cancel and miss out of, and friends and loved ones. But I want it as much as everybody, even the kids. A lot of people want their kids. They want them back in school, and it's really hard on them. I kind of look at it as the short term right now that we're doing it and it's working can prevent long-term issues.